pausing for the announcement that it's recording.
Yes, just one moment.
Perfect. Okay, welcome everybody. Chair Heineman cannot be with us today, so we do need, in accordance with Robert's rules, to take a motion from the floor for a chair for the day. This is not any form of action that puts a vice chair in place. We might want to have a conversation in December about putting some policy in place, but for today, Robert's rules allows me as board secretary to seek a motion from the members who are here, and we do have a quorum.
Melissa. Oh, go ahead, Senator Sykes.
Sorry, Suzanne. I would nominate Lietta to be a chair of the day if she has served on the cabinet longer than any of us. So I think we would be in good hands. So I would make that nomination.
Thank you. Do we have a second?
I'll second that.
Thank you very much. All right. So I think we can do this by a voice vote. All in favor, please say aye.
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 I'm factual. Like, I don't need aye.
Any opposed? Okay. Lietta, if you would take over and do the honors to preside over the meeting, we'd appreciate it.
Okay, thank you, Melissa. Thank you. I'm honored to stand in for Chair Don Heineman, and welcome to the Friday, October 3rd, 2025 Kansas Children's Cabinet meeting. It looks like we only have one item of business today. It's to approve the minutes from our last meeting from August. If there are no objections, revisions, amendments, we could do this by acclamation. Does anyone have any changes to be made? Seeing none, I would entertain a motion.
I move the minutes.
I'll second.
Oh, great. So that was Laura Williams made the motion, and Senator Sykes the second. So by acclamation, I will declare them adopted. So next, we'll just move into our report section, and keeping with our tradition, we will hold our questions until the end of each report, and just make a note if you have a question on a certain slide, and we can go back to that. We will kick it off with the Kansas Children's Cabinet and Trust Fund Wellbeing and Prevention Portfolio with Melissa Rooker, Executive Director. Thank you, Melissa.
Thank you, Lietta. Good morning, everyone. The purpose of today's meeting, in the absence of any grants to approve or any actual orders of business that need action, is to capitalize on the opportunity to bring you information. We have enough new board members that it seems like a good time to take a pause, reflect on some of the questions that we have had through prior discussions, and use this as an opportunity to connect the dots. You've had board orientation meetings with me as you have been appointed, and there's a lot of information packed into the orientation kit that we create. There's a lot of information from one meeting to the next. That today is really about helping you see how the annual continuum of our meetings leads to the annual report that we'll bring you in December, and how those pieces all fit and interact together. So if we could move to the next slide, Lindsay. Just a quick reminder of the statutory structure for the Children's Cabinet. We were created in 1999. Kansas was really a pioneer in establishing a comprehensive system to support children's needs. We were both the first state in the nation to establish a children's trust fund, as well as, and that happened in 1980, but then we were the first state to actually devote the state share of the master tobacco settlement funds to meet the needs of children and their families. That was all accomplished by the legislature in 1999. The statutes that govern the Children's Cabinet are KSA 38-1901. We then skip and we pick up 38-2101 through 38-2105. So those statutes create the framework for the approach we take to the work we do, and the charge that we follow to evaluate the use of the Children's Initiative funds, the money credited to CIF. It is our responsibility to provide evaluation. So we take that very seriously. We apply these principles to all of the different funds that we manage because we think it's good practice. So we advise the governor and the legislature on the use of money. You do that with actions taken to make recommendations on the budget. We are also charged very specifically in statute with focusing on how to make sure that we're breaking down silos within the system itself to make it easier for families to navigate. So we are told to identify barriers and gaps in the early childhood system, help develop strategies for breaking down those silos. And there is specific direction that our role is to help support the prevention of child abuse and neglect. So we can move to the next slide. This is a schematic I think the board has seen before. It really just shows the sequence of the funding and how it moves. So the settlement agreement was entered into in 1999. There is an annual payout to the state, which is announced in April of every year. That annuity is by statute deposited into the Kansas Endowment for Youth. And then the annual state budget process presided over by the legislature is where the budget for the CIF is adopted. That is known as the Children's Initiative Fund. So the CIF, as we lovingly call it, is the working budget. The key fund is the savings account. So when we've had at our budget meetings, we always talk more in depth about the status of those funds. So if we could move on to the next slide. The cabinet in 2014, under the leadership of board chair Amanda Adkins, took the experience and work of the board up through that period, and the board did a lot of work on how best to operationalize and standardize and create a system of evaluation and a framework for investments that would give us a solid understanding of the impact our funding was having. And out of that work, which I think took a year or two to come together, the blueprint for early childhood was born, and we follow it today. It's the strategic framework for the work of the early childhood system. The goal is to ensure that every child thrives. The three pillars of the blueprint are healthy development, strong families, and early learning, so that these become the focus of our investment strategies. Healthy development speaks to making sure kids are on track developmentally, getting in with early identification and referrals. It's home visiting, it's parent supports, it's making sure kids have the right access to any kind of interventions that might be needed to help early, and make sure they're getting what they need. Strong families is the parent education and home visiting, and just a lot of different support programs that help parents. It's prenatal care, it's postpartum care, it's the home visits to help make sure that a new mom has what she needs, all of those things. And then early learning is pretty self-explanatory. We do include childcare in that pillar, and we have a focus on the type of programs that set children up for success when they reach kindergarten age and beyond. We can move to the next slide, please. The Children's Cabinet really has led the work of the preschool development grants, which is the collaboration among 4 state agencies. It has been going on since 2019. We appreciate Amanda Peterson for that first year being the head of this process for that first year planning grant. But the cabinet stepped into the lead role because it really aligns with our statutory responsibilities, and the work of the needs assessment process that was required of our original 2019 planning grant was comprehensive. We traveled the state. We did 53 listening sessions in communities across Kansas. We, through those listening sessions, surveys, a project called Our Tomorrows, and site visits and other types of feedback, we cataloged the voices of over 6,000 Kansans in the process of collecting information about their experiences. We have conducted needs assessments since then through the cycle of preschool development grant funding. We did updates that were more narrowly focused for 3 years running. It really began with the need to take a look at what was going on in 2020 and 21 with the onset of the COVID pandemic. And we wanted to check in and see how things were affecting the early childhood space. We did 3 of those targeted needs assessments, and then in 2024 we published another more comprehensive updated needs assessment. The central messages have remained pretty stable. The experiences of families with young children in Kansas are shaped by where they live. It doesn't matter. We're not just saying the difference between an urban setting and a rural setting. This applies within those settings. Where you live matters. So even if it's a small town, there's a difference between living out in the country on a large stretch of farmland versus living closer in to town. Or if you're in Johnson County, where you live affects the ability of families to access the services they need for a variety of different reasons. And we have documented that too many young children in Kansas are growing up in families where their basic needs are not being met. The first needs assessment is the one that was divided into the categories you see on screen, the key findings. Those are the sections that our original strategic plan for early childhood were constructed around. So accessibility of services, the availability of services. So you might have one without the other. You may have available services, but not be able to, you don't have the transportation to get to them. So they're not accessible to you. Or they may, it may be that you could get to the service location, but there isn't a spot available to you. So those kind of go hand in hand, but they are different in meaning. Workforce for early childhood is a problem that we've had our eye on, the shortage of people working, the wage issues, the need to recruit and retain and train and support has been on our radar since day one of that this portfolio of work. Systems alignment is also one that we recognized early on. We just had so many different boundary lines that were arbitrarily created within the system itself. We've been working very hard to improve that, and with the Office of Early Childhood coming online, that is a big step forward in terms of meeting the needs outlined at that time. We found that collaboration can be difficult. We've been working on fostering a more collaborative atmosphere among the grant recipients, among community members, and really activating on the idea that was presented at one of our early 2019 cabinet meetings, that we are all education or all early childhood stakeholders. So we're working to improve collaboration in a lot of ways. Facilities was another major issue. We found that things were in need of renovation, repair, updating, or didn't exist in certain areas, and that issue needed addressing as well. And then navigation was the idea that families were left to connect the dots for themselves, and that we needed a system that provided better support for families trying to make choices and seek the services for their children that meet their needs. We can move to the next slide. So all of that informed the All In for Kansas Kids strategic plan. I know every member of the cabinet has been equipped with a copy. It is online on our website and available, because again, with the idea that we are all early childhood stakeholders, we want this to be a plan that everybody sees themselves in. So we have tried to share it as publicly and widely as possible. It is divided currently into 3 pillars that have goals under each pillar, specific actions that can be taken to achieve those goals, and metrics to guide the process of considering whether or not we've met our goals along the way. The 3 pillars, one is the ecosystem. That is you see it on screen. It's the compendium of services that create the early childhood system of supports. It's workforce, because that is such a major issue that it has its own pillar. So it's hard to expand care if you don't have the people to provide it. And then certainly strengthening the experiences of children and families sets up the 3rd pillar of the strategic plan. So if you haven't taken a look at the current version, I encourage you to do so and follow along with the work that we're able to do with it. We can move on to the next slide. So for the purpose of this conversation about how this all links up and creates the portfolio of work that the Children's Cabinet Board undertakes, the most salient point is that evaluation is key to everything we do. And so we've set up a cycle of meetings that help build towards the annual report that the board adopts every year. And if you think about it, it's a constant circle that there's no start and stop. So if we just think about the ECBG, which is our signature investment in the CIF that this board oversees, as opposed to a CIF line item that transfers to another entity for the hands-on oversight. The Early Childhood Block Grant is the main topic of our April board meeting. You receive the recommended slate. We discuss how we want to grant the funding. And once I get those awards approved, they follow a life cycle that follows the state fiscal year. So the grant cycle, we use that period between April and July 1 to go through the steps of setting up the legal agreements, the grant award packages. They include detailed budgets, detailed scope of work documents, all the terms and conditions. We have to collect all kinds of forms and information from the grant recipients on an annual basis to meet other types of statutory responsibilities. So there's a process, a back and forth. Staff works with the chosen award recipients, and we get things set up so that there is a seamless transition between the fiscal year that closes June 30 and the fiscal year that opens July 1. We have an RFP, a public RFP process for early childhood block grant that opens in I think we kind of share out at the October meeting the news about the RFP. There's usually an application period that it opens in November and closes in early January. And then that period between the RFP closing and the April meeting is the review period. So there's a deep dive. It's ongoing all year long for ECBG. When we get to the June meeting, our team from the KU Center for Public Partnerships and Research brings the board our annual CIF accountability report. That report is that statutory item. This is our report to the board on the impact that CIF, as the whole budget, every line item, we bring you updates on the impact that those line item funding streams have had in the populations they serve. That Owen describes in great detail the process that the staff takes on our side of things to put that accountability process into action. You get the culminating report. That report is then incorporated into the annual report that you receive in December for publication. So, we are all year long building the contents. The Early Childhood Block Grant follows a system known as the Common Measures Initiative. It is a toolkit that has very specific evaluation and measurement tools so that the grant slate as a whole can be evaluated on a common set of measurement tools. We use some of those tools in other ways in other grant award programs. They're not all applicable to every program. So we make sure that care is taken to identify the appropriate measurement tools for a given type of service model. It is a rigorous process, and you receive that evaluation at the August board meeting. So we just had it. It was Dr. Lynn Schepperman from Wichita State University. She and her team work all year long. There are 3 windows of data collection from the grant recipients, and there is ongoing technical assistance provided to make sure the grantees and their staff members know how to implement and evaluate. There will be a series of site visits that Chrissy Wyckoff from our team and Dr. Schepperman undertake to do one-on-one sit-down conversations with each grant recipient. Those are happening this month, and it's a time when our grantees who are continuing receive the results from the prior year evaluation for their own program. It's a time for reflection on ways to improve. It's a time to onboard the new grantees, make sure they understand the Common Measures Initiative and they are conducting their responsibilities accurately, so that we have confidence in the data that's brought forward at that August meeting every year. We also in August take that moment to approve the slate for the federal community-based child abuse prevention awards, those follow a federal fiscal grant cycle. So that means the new federal fiscal year starts October 1st, and it cycles it to its end on September 30th. So we, as you know, from that August conversation, it's a little bit of a high wire because we are asking you to approve a slate tentative, based on tentative understanding of what federal funds might look like. You'll get a report a little later in this meeting about what actually ended up being the outcome of that. And spoiler alert, it's good news. So that is part of the August meeting cycle. The ECBG evaluation is another major component of the annual report. So you received it at the meeting. The slides exist. We end up putting a summary update into the annual report so that it is captured for posterity that way. There are other types of program evaluations that are going on all the time with the other programs that the cabinet oversees. So following this particular presentation, I will do a deep dive into the Capital Projects Fund. We've got Owen Cox from KU to present more on the child care. No, strike that, reverse it, just like Willy Wonka. I'm doing the accelerator. Owen is doing CPF, and we're gonna update you. We will also be providing written reports. These two reports will get posted to the cabinet website after our meeting, and I'll email each of you a copy of the PDFs so that you have them for reference. It's a unique one-time type of program doing very specialized work we don't normally oversee, which is construction and major renovation of physical facilities. So it's a different type of evaluation. These are progress updates to give you highlights and an understanding of where we are with those grant portfolios, because we are in the final phase of each of them. So we'll get into that a little bit later. And then, as we've been talking about, the annual report will capture all of those different components and a little more. We talked to you about in that report, you get the budget recommendation. If there are any recommendations throughout the grant year or the calendar year, we end up including those in the annual report as well. So far this year, I think the budget recommendations are the only things that we have adopted. But the annual report is a way of gathering up all of the details about the work the cabinet has been engaged in over the course of the calendar year and putting it into a publication that is then conveyed to the governor. I share it with KLRD, Kansas Legislative Research, so that it is accessible to lawmakers for help with all of the different decisions that have to be made during the legislative session. And it is posted online on the website so that it is publicly available. So when I arrived in 2019, the cabinet was still getting printed publications for each and every separate measure, and it was really unwieldy to try and wrap arms around. It was too much to be trying to wrap up at the end of the year. So the annual report format is really a more comfortable way of doing things, and I think is a clearer picture of the full package. We have a robust system of fiscal oversight for managing the grant programs, and we try and be as transparent as possible in our communications, which is why the website is really the hub for everything we do. We post online so that things are publicly available. So we can move to the next slide. I do want to take a moment to talk about why we focus on early childhood and do the things we do. On screen, you'll see a depiction of what's affectionately known in early childhood circles as the Heckman curve. Dr. Heckman is a renowned researcher in the field of early childhood and has really studied, has studied the economics of investment in early childhood, and the curve is a very clean, simple depiction of the the effect of the ROI when you invest early is much higher for the bang for the buck, so to speak. That really tells us that when we can intervene early and ward off problems later, we are leveraging those investments very responsibly. Because I was at a conference once, and Barry Ford from the Council for Strong America, he said, look, we're going to spend the money one way or another. We might as well spend it early because the results are so much better, and it's better to invest in giving children a healthy start in life than it is to pay for their incarceration as adults because things went awry. So that is the philosophy that we use. We really focus on the ROI of things. So we can move to the next slide. So what we see in Kansas, because we know that nationally there's different findings. We know that Alabama found that for every $1 invested, they realized $4.93 in savings to the state in immediate and long-term benefits. Kentucky did a study, and they saw a major decrease in spending on foster care because there were so many fewer children being referred to services. We see similar results in Kansas. We've seen a 23% decrease in children placed in foster care and out-of-home placements since state fiscal year 20. It really aligns with the implementation of the Family First Prevention grant portfolio. What we see reported is that since that grant rolled out, over 7,700 families have been referred for services provided by the grant, and 90% of the children in those families have remained in the home, not needed to be removed to foster care, which is huge. Foster placement is trauma layered on top of trauma for children. So if we can avoid that trauma from happening by wraparound care for the family and interventions that help support them so children can remain safely at home, but then everybody comes out as a winner. We have done some pilot work, partly the Family First program. Family Strong is an initiative. We have a couple other initiatives, community health workers in schools, some of our CBCAP funding. There's been an intensive effort in Southeast Kansas to pilot some strategies, and there's been a 29% decrease in out-of-home placement in that area. So we can move to the next slide. We, as a cabinet, have our own study that we conducted in partnership with TOP Early Learning Centers, the Opportunity Project in Wichita. It was a multi-year longitudinal study, began in 2008, and a cohort of children with their parents agreed to enroll their children in the study. They were parents of students enrolled at TOP as in the early childhood spaces. So I think it started with 3-year-olds in preschool. The partnership in this project is the Wichita Unified School District, and they followed the kids all the way through high school graduation and saw consistently better test scores, higher GPAs, and lower suspension rates. The top graduates had 24% fewer special education placements than their classmates and were over 13% less likely to have repeat discipline referrals. It translated, there was a cost analysis conducted in 2016 that found that for every dollar spent, there was an $11 return on that investment. It was cost avoidance from the reduced special ed costs and other factors that were taken into account. You can see on screen, TOP publishes the metrics on their website. Their graduates are 30% more likely to achieve appropriate reading and reading results on the state assessments, and 46% more likely on math. The cabinet has also done what we call an authorized project of the Early Childhood Data Trust, and that was a comparison. We matched our data with DCF under a data sharing agreement and evaluated the results. It was both ECBG and CBCAP matched in with DCF data. It was first done in 2022 and then updated last year, and we found that our portfolio has also helped reduce foster care placement by 28%. That is up from the original study, which found 23% less. So I would say it's the strength of the work we do and the impact that the Family First prevention services have had on the system. So the improvement is, it's what we would ask for. Like, this is what we want to, it's what we hope and think happens. It's what research tells us should happen, and we can demonstrate that it is happening. Foster care numbers are going down, and children are in more stable settings at home. When you factor in the cost, the annual cost of foster care for a child, and you look at the reduction in foster placements, it translates to $21 million saved because children have not needed to be placed in foster care. And then there's also other intervention costs. So the opportunity project study and the cost study have both been made available to you as board members, but it's again posted on our website, posted on the TOP website. I think it's something that if you haven't taken the time to review, it's well worth it. We also have the authorized project. We've got that in the resources section of our website. The update was included in last year's annual report. We're not doing this analysis each and every year, so probably less focus on that in this year's upcoming report. But we like to keep you posted on the progress that we're making with these investments that we are privileged to administer. So we can move to the next slide. This is a range of programs in our Children's Cabinet portfolio. It's a combination of CIF funded and federally funded programs and services, but this is what we consider our prevention portfolio. It's part of the effort that it lives in other places as well, both in the public and private sector. Kansas is one of 22 states participating in a national cohort known as Thriving Families, Safer Children, which is a project that the HHS Administration for Children and Families, in partnership with Annie E. Casey and the Casey Family Foundation, Prevent Child Abuse America and other national funders and partners initiated. And so we're in the second cohort of states to join that effort. It's been a number of years, and it is the holistic linkage to this selection of programs. There's a Kansas team that involves the relevant state agencies and outside partners like Kansas Children's Service League and others to create a well-being focus. We invest millions in the child welfare system, the system that kicks in when there is a report of suspected abuse or neglect. And it, it really is better for kids when we focus on trying to prevent the need for that type of phone call and subsequent investigation and all the things that happen when there is a documented situation of abuse. So it's our CBCAP grant. It's a different federal initiative. It's a grant known as CanLink, which is a part of that, in part helping with the Southeast Kansas pilot. It's a way of addressing the referrals and transitions between types of service. It's our well-being pathway, which I have a slide to talk about in a moment. It's our early childhood block grant. It's the investment in 1-800-Children as a resource for parents. It's the Imagination Library to help foster a love of reading and that family bond that happens when a parent sits down to read a book with their child every night. So it's the approach we take at the cabinet because there's a large state agency devoted to child welfare. They assist with child well-being as well, and we appreciate the effort underway throughout our system to make sure that we are keeping child well-being as a strengths-based approach in the mix and addressing those needs appropriately. If we move on to the next slide. CBCAP, just wanted to note that from our evaluation, we take in comments and observations from grant recipients and the people they serve. You can see family perspective. That's just one comment made by a grant, a family receiving services. But CBCAP programs really are designed to help with skill building, parent education programs, case management, mental health supports, certain concrete supports to help families out. There is an emphasis on empowering parents rather than creating a climate of dependency. The programs value feedback from families who've received services in the system, and the case management really sets up individualized problem solving to form the backbone for support for the families involved. We have certain statewide initiatives that CBCAP helps fund: Child Abuse Prevention Month activities, 1-800-Children, and professional education for providers. We also host the governor's we contribute funding. I shouldn't say we host with the governor's conference on the prevention of child abuse and neglect. So there's a lot of work done statewide. The grantees have community-based programs that provide crisis intervention and prevention. So it's like the Wichita Crisis Nursery is an example. It is a safe place for a family that feel like if a parent is reaching that moment of feeling like life is, there is something happening and I have to have a safe place for my child right now, this is a drop-in place. You can bring your child and safe, they can be cared for safely. The Family Response Advocates program, which is a team of social workers that assist the police department in Southeast Kansas and Pittsburgh and surrounding areas, that has had a huge positive benefit Not every call to 911 is a criminal matter requiring police intervention. Sometimes it is truly an emergency, but the type of response that is appropriate is better provided by a qualified social worker connecting that family to a different form of support, and not just trying, the police are there to stop crime and arrest criminals or suspected criminals. So it's a different approach to partnership with law enforcement. We have programs that provide early identification of adults who need substance abuse treatment, parents who have issues and need referrals to treatment, in-home visits to support families with all kinds of different challenges. So it just, there's a whole portfolio of programs available to be supportive and help strengthen the family unit. The Kansas Wellbeing Pathway, if we could go to that next slide. The Kansas Wellbeing Pathway is a project that was born out of the observation that it's the community level where the brightest spots are the highlights, it's communities leading the charge. And we are a big believer that if something is happening at the local level, other communities might learn something from that. And so we had a little bit of CBCAP funding that was actually, it was American Rescue Plan pandemic relief funding. And this wellbeing pathway was a project born out of a desire to do something lasting with those funds and something meaningful that would help strengthen the continuum and create a tool. So using all sources of publicly available data, we've created a dashboard that measures progress on a variety of metrics that uses a strengths-based approach. So we are not saying this community is not meeting a benchmark. We're saying, you can see on screen if you can read the slide, the way we are assessing where a community is, and this is county level. So, county by county, we show whether a county is just getting started. Maybe there aren't initiatives. Maybe they've just got one or two things happening on a specific indicator. They just started something and they're taking a look. They've got a community advisory group that they've put together that wants to address a challenge, a housing challenge, a childcare challenge, or whatever. And so that is the just getting started. And we want to celebrate that there is that effort to take a look at things and try and figure out where they're going next to address community level issues. The strengthening is, they've made progress and they're working towards goal. There's the color coding is to serve as a heat map, how far along they are. And then excelling are those communities that have hit something out of the park. They've got something really wonderful happening. And so this is about highlighting and lifting up actions and activities that are working, effort to address the issues and move the needle. So the dashboard includes the indicators involve health, community, environment, financial, learning and development, and then the last category is family and household. And it's an interactive dashboard. When it goes live, which will be at some point this month, we're committed to roll out this month. You'll be able to click on a different county. It'll pop up. It's got linkable links. It's got ideas based on, we feature projects that have addressed something successfully that we think are really innovative and unique that we just want to bring attention to so people can learn from them. That's what all the clickable links are. So it will be an interactive dashboard that should help communities that are seeking grant funding. This is the type of information that a successful grant application should include, the snapshot of what is happening in your community, where your needs are. So it is designed to be a tool for communities, and it's a dynamic item. So, it will never be complete. It will always be a work in progress because there's always room to update and add when we see progress and new things to highlight. So, okay, it's a lot, but I hope that the context of this helps you see how each of our meetings helps build towards an annual report, the accountability for the work we're doing. You might notice that there wasn't much said about the February board meeting. It is, as important as any other of our 6 regularly scheduled board meetings, but we studiously avoid having to bring action items that might set up we're acutely aware of the legislative session being underway in February. Generally, we've had good luck knowing that Fridays are lighter days for lawmakers, but February is a time to kick off the new year, take stock of what we have going on. There can be reports and updates that matter. There might be items for consideration, but no grant slates to approve, and no none of that type of business that would suffer if we didn't have the strength of our full board present. So we try and be very mindful of the tug on the legislative schedules at that time of year. Okay, pausing there. Chair, we give it back to you.
Thank you, Melissa. That was packed full of information. I see Senator Sykes has a question or comment.
Thank you. And sorry, I know we were waiting till the end, but I put my hand up there so I would remember that I had a comment.
You're fine.
Melissa, this was wonderful. Thank you for giving us that kind of circle of how things kind of go around, but are still innovative through that. But my question, and this is, serving on the cabinet and then being off for several years and coming back, talk to me about that evaluating and accountability. And I know there's that legislative post audit at some point where, the children's cabinet and the work that we do in the programs, like we were the gold standard. So can you just comment on that and how it all works together?
Thank you for that question. Yeah, it was. So we've been the subject of legislative post-audit study. We have been referenced in legislative post-audit studies of other agencies and their approach to moving aid to local fundings, grants, and that sort of thing. Our process has been reviewed and found to be, as you said, the gold standard for how a state agency should consider granting money. It's both the front end, the public RFP that we release for any of the funds that we are contemplating granting, so that it is a competitive public process. It's the rigor of our review and analysis of the applications received. The rubric that is used by grant reviewers is made available during the RFP period, so people understand the criteria that we are looking for and will consider in successful applications. It's the process of bringing this board the slate of recommendations for the grant awards and allowing the board to review and decide on how to approach the actual award amounts and adopting that through this very public process, public meeting to receive the recommendations, have time for board questions and discussion, board decision making, and then the actions the staff takes to award, create the documentation to award, the process of collecting invoices and the documentation needed to back up those invoices. We follow uniform grant guidance principles of grant making. That is required in situations where we are granting federal funds. We apply the general principles of uniform grant guidance to all of our grant portfolios. So it's cost reimbursement basis. When we grant money, a program then invoices us throughout the year. Most of our grants are on a monthly billing cycle. So we don't just say, we're going to award you X amount of money. Here you go. Go spend it wisely. Promise you'll spend it the way you've told us you're going to. We track all year long on a monthly basis. We're tracking spend down and working with grantees when there needs to be adjustments. And sometimes, if they were going to fill a position to do a certain thing and have trouble hiring, they may have 2 months worth of that salary that wasn't spent. We work with them on allowable uses of funds in the context of the award activities that are approved. So it might bump up the amount of scholarship funding made available to families if they've got that extra salary that wasn't going to be spent in that grant calendar year. So it's the fiscal oversight. We have a grant closeout process every year. Things that information we seek to ensure that we have put each grant cycle to bed appropriately. We also have, it's not just the financial reporting, it is the impact reporting that also goes into it. So it's our common measures initiative and the other types of evaluation that we apply as a condition of accepting a grant. It does not matter what grant we are offering. There is a system of evaluation in place so that we can have both programmatic reports and financial reports available both to you as a board, the funders of record, be it the state legislature and the governor, be it the federal side of things. Even when we get a private foundation that grants us funding, we have a responsibility to report to them as well. So we make sure that we're gathering the metrics all year. And it is the strength of that whole approach to grants making and grant administration that has earned us that seal of approval. It was the Alvarez and Marsal efficiency study it was commissioned by the legislature in 2015 and I think delivered in 2016. And then legislative post audit has pointed to our approach and recommended to other agencies that perhaps they follow suit and put a similar process in place. So
awesome.
Yeah.
Thank you, Melissa. And any other questions? Great report. If we wanted to get a copy of that slideshow, could we?
Yes. So we have a section on the Children's Cabinet website. So I certainly can email the slides to board members, but just for the general public, if you navigate to the Children's Cabinet website, kschildrenscabinet.gov, there's a drop-down menu that has meetings. And when you click on the meeting link, you'll see not just this calendar year, but prior calendar years are archived there. For each meeting date, the slide deck, the agenda, the minutes that got approved that coordinate with that meeting, and any supplemental materials that the board receives or that we are publishing. That is where you find them always. Certain reports get cross-referenced elsewhere, but the meeting materials always are publicly available the afternoon of our meetings. It will include a live stream of the meeting. So if somebody misses a meeting, it is captured for posterity. We are live streaming right now. We have a YouTube live stream, and then the meetings are recorded. So
transparency in action. I appreciate it. Thank you. Thank you so much. So next we have Owen Cox, the Assistant Director of KU's Center for Public Partnerships and Research. He's going to give us a presentation on Child Care Capacity Accelerator. I'll throw it to you, Owen.
Leetta, I wanted to just take a moment to set the scene that this is a presentation that is, I mentioned when the needs assessment slide was up. We are making these connections for the board, that the Child Care Capacity Accelerator and the CPF didn't just appear on the horizon. Pandemic relief funds were made available for early childhood and child care support. And what, we heard loud and clear that they needed to be used in one-time ways and not set up a sustainability issue that the state budget would be strained by. So thinking about one-time investments, I think our cabinet should be really proud of having found a way to make generational investments in expansion of access to and availability of childcare. So that is for both the accelerator and the subsequent report on the capital projects fund. That's what I want you to keep in mind as you're listening to the report. So Owen, I'm sorry to step in there, but I just wanted to frame it, and now we'll turn it over to you.
No, that's fantastic, Melissa. And thank you for that. And I'm really happy to be here to share this information with the board. And Melissa, I'm really happy to jump in here just to give you a break for a second during the presentation as well. I think you teed up great for me there. I was scribbling down in my notes as we were going through those slides that I think if we remember back to that slide on the key findings of needs assessment, I think the accelerator actually hits on all 8 of those key findings. And so it really was a fantastic opportunity for the state of Kansas to be able to use this one-time resource, one-time opportunity to really take advantage and move that work forward. So I'm very excited to talk a little bit about where we're at right now on that process. So some of you who have been here for a little while might remember that last October we had an in-person meeting and I presented some findings for the accelerator project at that meeting. That was 1 year in for our grantees at that point. And so we did a sort of a little update on that, and we have a new report this year. We're calling it the Impact Report. That report itself will be available on the Cabinet website as well. So that same URL that Melissa mentioned, eventually this report will be posted there for you to look at as well. So just doing a little overview and reset on what the accelerator was. It was, again, that one-time opportunity, and it came from a sort of, the cabinet was able to braid some funding sources together to be able to provide that opportunity. So we had some of those relief discretionary funds that were available, also some CCDF discretionary funds. The PDG grant was also able to kick in money. And I think importantly, beyond those resources, Patterson Family Foundation also stepped up and was able to provide additional resources. One thing that I want to mention on that is that these were braided funding resources. So they all had different reporting needs. They all had different timelines. And the cabinet really wanted to make sure that in that braiding process, that the cabinet streamlined that for the grantees themselves. So the cabinet was able to track the funding sources and the requirements for each particular grantee, and then build out a reporting structure that allowed them to do one report and not have to do multiple different reports when it came to their sort of reporting and I guess their frequent reporting structure. Just to think back to a little bit on the actual purpose of those funds. Again, this was for the building or renovating of spaces, and to provide major startup operational funding to create additional licensed childcare spots. One of the reasons that we talk about this as being sort of a generational investment and a great opportunity for one-time investment is those are types of supports that aren't often available in the childcare sort of sphere. Oftentimes, infrastructure type supports like that are not going to be available to the scale that we were able to leverage for this particular opportunity. So within that, the accelerator's goal was to create a more sustainable licensed care slots in the state and accelerate capacity building, as well as look to communities in Kansas for innovative ways to accomplish these goals. Some of the outcomes that we'll talk a little bit about here today are going to be an increased number of licensed childcare facilities, in particular ones that can offer full-time year-round programs and capacity to serve this early stage of life, right, birth through 5. We've also seen an increased recruitment and retention of childcare professionals. But as we go through the presentation, I'll note that these are some of the outcomes that we sort of think through as sort of our counting outcomes. But we have outcomes that stretch far and wide beyond just those here today. And we'll talk about those when we get into some of our impacts. So I think we can go to the next slide. Okay, so where are these grants going? So as you can see from this map, we have 63 community grantees. So those were awarded over 2 separate awarding periods several years ago at this point. And so 63 community grantees were awarded. We had 142 proposals received, of which the 63 were granted. But I do want to note here, each of those dots represents one of those 63 grantees. But those are just the grantees. Many of these projects were actually collaborative projects. And so if we were thinking about the actual providers, there would be a lot more dots on this particular screen. Some of those collaboratives had upwards of 9 different providers coming together under one sole grantee, but those funds were able to be dispersed among all of those providers. So while we have this representation here, this is just from the slate of proposals that were awarded, not from the amount of impacts of communities across the state. One success that I do want to note right now is that of those 63 grantees, we only have 3 remaining construction and renovation projects outstanding. So they are still in the process, and that still works within their timeline. Their timelines are like I said earlier, are set by the different funding sources. But some of those are some of our larger projects, and they are still in the process of finishing up their renovation construction projects. And we'll reference some of those a little bit later in the presentation. But as I said, there is different timelines for when the grants were supposed to be done. So last year when we did our presentation, we had sort of had a handful of the grants finished, and we've had a bunch more finished throughout the course of this last reporting year. All right, if we want to move forward. Okay, and so here are some of those sort of outcomes statistics that I mentioned earlier in a couple slides back. So as of right now, again, this is impact to date, accelerator grantees are projected to create 5,101 new licensed care slots across the state. I do want to note here that some grantees said they anticipate additional growth and have adopted business models, allowing them to increase even more slots over time. We are actually right now, as of 2 days ago, in another reporting period for the grantees. So we expect to receive some more data here recently, and we'll be updating the numbers as that comes in. So I just wanted to put that out there and also give another word of appreciation for the grantees for filling out those reports for us. Importantly, of these new slots, nearly 30% of them, or almost 1,500, care for infants. So this is something that we've seen in the various needs assessments and needs that come out of strategic plans. And it's often difficult. That's a difficult age range for providers to be able to provide care for various reasons. And one of the great things is that 4 of our counties that are represented by accelerator grantees, they previously had 0 capacity for infant care, and now they have infant slots available. And so I think that's a fantastic way to sort of look at some of the success. I also want to note one of those outcomes that we mentioned was also the recruitment and retention of staff to childcare. And what we've seen from our accelerator grantees is that they have hired 802 staff to ensure that we can get this capacity and quality care and education for our children and in those communities. Okay, we could advance one more slide. Okay, So this is an insights and takeaways slide. I wanted to spend a little moment here to sort of give a couple examples of what we're seeing. One of the things that was really important is we wanted to see, like, what are the benefits to children and families? What are we hearing from our grantees? What are we hearing from communities? What does that look like? And we also have got some really interesting insights from our ability to leverage public and private partnerships in this particular grant. So just starting there, one of the things that I think I've heard from multiple cabinet meetings is just really focusing in on how do we make this affordable for families? What is this doing to increase the affordability for families? And the accelerator and the grantees, they've actually helped on affordability from sort of multiple fronts. So as far as grantees, they accept a variety of payment supports. Those can include state subsidy supports like military pay or Head Start, some others. And in some cases, the childcare providers that have received these grants are really the only childcare provider in their area that actually accepts DCF subsidies. So really just increasing the ability for folks to be able to have affordable care. But there's other ways that the accelerator grantees have looked to try and increase affordability as well. And that is that we have a number of grantees who actually have partnered or are themselves businesses and that provide employer subsidized childcare, which is where local employers will pick up a portion of the childcare costs for their employees. So that's a great sort of collaboration between the public and private partnerships as well. But we also had a number of philanthropic partners that can provide early education scholarships to low and middle income families. I don't know if I'm going to necessarily name drop things here, but for those of you who are fans of football, one of those partners was the 15 in the Mahomes Foundation in the Kansas City area. So just another nice example of ways that the grantees have leveraged community options to be able to make things more affordable. Another important thing that we found that was really beneficial both to parents and to employers as well is that a number of child care grantees used this opportunity to offer extended hours, sort of thinking through like after their regular working time hours in the day. So thinking like expanding from 7 a.m. to 6 p.m. because we know that for a working family, if you need to get to the job at 8 and you leave at 5, it can be difficult to actually get to your kids without having to take off early or leaving work early. We also have an employer-based organization that was partnered with during the grant with the grantees, and it actually that employer-based childcare organization stays open late until after that employer's plant lines have finished, and that way they can finish their workday and be able to more easily get their children from childcare. And also, we've got some grantees that offer evening, night, and weekend care, which are obviously times where childcare is just not as available oftentimes, and just really extending the ability for families to live their life, work their job, and be able to still pick up their kid and have that childcare provided. All right. So the other thing that we've can we go back real quick? Spoiler alert, there's going to be some pictures here in a second. Those are going to be exciting. The other thing that within that is the expansion of the ability to provide services to children with disabilities and support needs. Some providers have built in additional learning environments like sensory rooms that allow teachers and specialists to conduct screenings or therapeutic interventions that might be needed. Other programs focused on hiring individuals with backgrounds in fields like special education or providing specialized training to educators, really just expanding the ability and capacity of childcare across the region to provide those services for children who may have those needs. We've got enhanced childcare quality and services. And so some examples of this include a grantee who was able to support modification of their curriculum to be an all ages curriculum that was needed for small providers in their rural community. But not only did they do it for their providers of that grantee, but they then offered that to all childcare providers within their 3-county area. So really, again, this sort of like community approach, able to leverage the funds through this project to provide that boost in quality. But instead of just having it for your provider, it's really a community-based approach where we can spread that so there's quality education for the early years across that 3-county area. And then the broader economic impact, obviously, we've talked a little bit already about the ability to have childcare for families who have jobs and are needed to work in their community. But other ways that you can sort of see that is we've had several grantees who've actually built facilities in proximity of sort of large scale employers. That way it's just so they have that close proximity to be able to take their kids to and from childcare and not have to deal with as much transportation issues that sometimes come with childcare. And then they've also had a couple of grantees who've really highlighted how their projects have utilized existing community spaces that had actually long been unoccupied and non-contributing structures in their community, but those now are coming to life and really providing additional impact to the communities at large there. All right, so if we want to turn over to the leveraging of public-private partnerships, community partners have really invested in a whole host of ways. Municipalities and counties have donated land. They've also provided financial support and helped carry out activities. Sometimes that might be the annexation of land to enable a facility to receive local services or other opportunities. So that's one way that communities have really helped invest. And one local community foundation, in fact, also launched what they called a Child Care Dream Fund. And that will provide financial supports to local child care providers every year in the future to help cover unexpected costs, hopefully increase staff pay, or undertake projects just to enhance quality in that community. So ways that folks have come together through this grant and put together these fantastic groups that are really working to not just use this one-time funding, but keep that momentum moving forward as this funding goes away. Thinking through here about how it can deepen the understanding of community needs and increase buy-in when we think through these partnerships. The Child Care Capacity Accelerator supported public-private partnerships as one of its key features, and it included a number of community coalitions that involve broad partnerships to develop their own community-based childcare solutions. I'm going to mention one example here, and I think I'll mention it again. But in Reno County, they have a childcare task force, and it undertook a market study and a listening tour to collectively understand the childcare needs in their community and then adjust their plans to make sure that they're working toward meeting those needs. All right, that's an example of being responsive to community needs, but we have a couple others as well. There's 2 employer-run facilities themselves, and they were initially going to be employer-run facilities where their employees would be able to receive childcare. But in the process of building out their projects, they noticed that the community still had need, and so they have actually opened up slots not only to their employees, but to community members as well. So another sort of community-wide impact. In Emporia, the local coalition there for the grantee engaged the Flint Hills Technical College to help address not only the needs for slots, but also for their employees. So the college has a new early childhood program, and they also utilize existing childcare providers to provide experiential learning environments for their students, enhancing their educational experience and helping meet the needs of future staff in the child care field. So a really great community partnership there as well. That's another couple examples here of collaborations with existing childcare providers. McPherson and Sheridan County both indicated that they were having ongoing monthly discussions with their childcare providers to understand their needs and help build relationships with business leaders. So again, a connection between existing childcare partners and new folks within that community to really move forward and try to sort of boost our efforts in the regard of the capacity building. There's also a new program that was developed, and what its purpose was to provide administrative and operating supports to childcare providers in that community. So instead of having to focus so much on the business, they can concentrate on their own education and service to those children and families. And they can use that nonprofit to help carry the load on the business side. And again, sort of this idea of like a shared service that can help multiple providers within a specific community. And then finally, just one more highlight on employer-sponsored childcare. Several grantees are actually in businesses that initially sought childcare facilities to meet the needs of employees. And as I said, those have been great partnerships, but those also have then expanded to meet more community needs and have opened up more capacity within their community. So just some insights and takeaways, some impacts that we've seen both for children and families, but also for the communities and even the business community within these particular regions that were awarded grants. So really excited about some of the things that we're seeing so far. And I think we have a couple more slides that I think highlight a couple of these particular grantees. I should note that while we're going to cover a couple grantees, there are a lot of them. There are a lot of great and fantastic success stories. That's one more plug for folks to go look at that impact report that'll be posted. These ones we have some nice pictures of. I think you'll see occasional posts that come out that show some other folks that have got some pictures, but we've got some nice photos of a couple ground breakings, a couple openings, and a ribbon cutting here or two as well. So I mentioned earlier some of those collaboration grants where we had multiple providers or community groups coming together under one grantee for a particular project. So highlight one here, which is the Reno County Child Care Coalition. That was the lead, and they supported 9 individual sites. And 4 of those sites were in small scale communities, so communities with populations under 1,500 people. That particular project was able to add 467 slots, so you can imagine the impact that has for those communities. And one of them that's highlighted below is the Pretty Prairie Community Childcare, and it has 24 slots now. It's bringing childcare options to a community that has gone several years with 0 facilities. So it's like brand new opportunity for that community to have childcare. So a fantastic example of the impact that the grant is having. Saline County, the Salina United Way was the lead. They're supporting 6 individual sites, and that has doubled the number of facilities who can serve infants. In addition, that they've also added 226 slots. Highlighted there in the picture is St. Mary's Love and Learn. They themselves have 114 slots through a major building expansion and renovation. So again, this permanent infrastructure that's coming up and on board now for these particular grantees. That includes new infant toddler classrooms and outdoor spaces as well. So just some of the community impacts that we are seeing. I think we have one more sort of slide here, Lindsay, with a couple more to highlight. Yes, absolutely. So one of the ones we like to talk about quite a bit is Sugar Creek. These are one of those employer-sponsored partnerships. They're going to have 200 slots through the construction of a new building on their business campus. So again, this close proximity for the employers, employees to have childcare. And they're really working to meet the needs of local families. Great picture there of a groundbreaking with, I love the kids with their hard hats on. It's one that makes me smile. And then finally, one last to highlight is the Treehouse of Learning. So they've created 53 slots via renovation, and they have helped a small childcare business owner expand her family childcare business to a licensed childcare center. That's also in what we're describing here as a prime location there in Independence, Kansas. So sort of, I don't know the exact street. I was going to say right off of Main Street, but off of one of their main thoroughfares in a building that hadn't been used, and it's really sort of brightened that area of town. So some fantastic work from some fantastic grantees. I'm very happy to be a part of this presentation. I can sit and hold for any questions, but before I do that, I do want to thank some folks, in particular the cabinet staff for their due diligence in helping us to gather reports, all those financial reports as well. They've also supported site visits for folks to go out and meet these grantees in person. We also have a lovely staff here at the Center for Public Partnerships and Research, who a lot of what I presented today was work based on what they have produced. So I want to give them credit as well. And then I'll pause right there, Melissa.
Well done, Owen. That represents a ton of work. Do we have any questions or comments? A brilliant report. Thank you so much. And thank you to everyone represented in the report doing the heavy lifting throughout the state for our Kansas kids. Let's move on to our next Capital Projects Fund presentation with our Executive Director, Melissa Rooker.
Thank you, Leetta. So Owen, thank you for that. And the next iteration is the Capital Projects Fund. This came to us as a project, as an opportunity to leverage American Rescue Plan pandemic relief funding that was it was a particular program in the federal legislation that set up American Rescue Plan that was known as the Capital Projects Fund. It is administered through the U.S. Treasury Department directly, and the accelerator the Capital Projects Fund was originally conceived in that law when it passed, I think in 2021, as broadband expansion. But there were other congressional actions taken, appropriations for broadband expansion across the country specifically. So they went back and revised the criteria for this to broaden from it still has a heavy emphasis on broadband expansion, but there was a category opened up for the construction of multi-purpose community facilities that offered programs that supported work, education, and health monitoring. The buildings must be equipped with broadband capabilities. And I think that you've heard me talk about this project before. It was a Kansas request. We crafted a proposal that pitched to U.S. Treasury the idea that we also require that these buildings house additional childcare capacity. And that was an 18-month negotiation with US Treasury to get to yes with them. But we did it. And we were able to we were allocated $40 million of the Kansas share of this program. The rest is being managed through Office of Recovery and Department of Commerce for broadband specific expansion. But our fund, our piece of it was, we just put it out as the Capital Projects Fund. Accelerator. It was a public RFP. It followed our same grant making process. This board did 2 rounds of decision making. We had 3 projects in the first round and 7 more in the second round to offer these capital project fund grants. It was July of 2023 when we received the go ahead from US Treasury. We tried to, the reason for the 2 rounds of funding was we thought there could be communities that were shovel ready, and so we had a kind of a fast track. If you're good to go, we've got this RFP rolling out with, we'll close the application window. I don't remember the timeline. But it was a shorter window, and then that same RFP, there was a track that remained open for a longer period of time to give people the time to think and work in their communities to put together a proposal. So the fast track realized 3 projects, and the second phase was 10 more. So if we go to the next slide, I think you'll see the map. The lift was heavier to put together a viable plan that covered all of the requirements. And so we had fewer overall applicants. We gave larger awards for this program. The ceiling for awards was we kept them under $5 million. So 4.9 million is the largest of the awards that we granted, but we've reported to you over time on the range of the award amounts. We are really pleased with the progress being made on these projects. 2 of them are open for business. We've celebrated ribbon cuttings with them. One is the Manhattan area incubator, and the other is Ellis County, the Grow Hayes development, which we'll talk a little bit more about both of those. But those are in operation as of this fall. We still have 4 more slated to open over the course of the next month or 2 before the holidays set in. These 4 additional sites should be open and operational. And then in 26, at various times throughout the first half of 2026 through the summer, we have the remaining 4 scheduled to complete and come online. So there is a a lot to celebrate in this project. The projects themselves have a really interesting individuality about what each community is offering in their programs. Lindsay, I think we can move to the next slide. So I mentioned Hayes, the Bob and Pat Schmidt Community Center opened at the end of August. Senator Moran was there to celebrate the milestone with them. This project, we worked with a community coalition known as Grow Hayes. They were the lead grantee. They have the Hayes Med Center adjacent to this facility and is one of the major partners that is helping them provide the health screenings and the care that is meeting that requirement of the federal criteria. They have the Hayes Economic Development Council is partnered and uses the space as community meeting space. They've got a downtown Hayes facility, but they have had more requests for bookings than that site has space for. So this site is now a second option for people seeking to hold business meetings and job fairs and all sorts of work-related activities. And then what's unique about this one is they have located a senior center on site. So there's a portion of the building dedicated to space for seniors for daytime care, for various activities. Meals on Wheels delivers food so seniors can gather and have social interaction as they break bread and just have that communal time together. There's also the childcare component. So across on the other side of the central meeting space, they have built a childcare center, and there are various programming options that bring the kids and the seniors together. So it could be some arts and crafts, it could be reading time, it could be music, that the performances that are brought in, or different types of experiences where the two generations are able to spend time together. There's a screen porch area for the seniors that overlooks the playground, and we hear reports that is a popular feature because they enjoy in pleasant weather being able to watch the kids at play and enjoy that interaction. And then this building is built to specifications to serve as a community storm shelter site. So it can house up to 350 people during weather emergencies, tornadoes and such. It is located, you might say, well, how are they going to get there? There is a neighborhood around it, and so this is really a nice hub for the Hayes area. The program will involve, they're going to test a program where they provide childcare for evening hours 3 nights a week, open up the computer lab so that people can, they've got a partnership with the higher ed to offer access to night courses on site, so people with kids can come take their coursework, have a safe place for their kids to be cared for a few hours while they are doing the work that they need to be doing. So we have high hopes that this will be an innovation that others might want to emulate in other ways. So it's the full package. It hits all the right criteria with the partnerships they have in place, the type of programs being offered. I think the seniors are putting together, at the time I did my site visit a few months ago, they said the seniors were seeking a national square dance competition for the central meeting hall to host. So we'll stay tuned to see what kinds of activities end up being able to take place in this facility. Next slide. The I mentioned the Manhattan area has the Flint Hills Community Accelerator. That is the picture at the bottom left of the screen. The ribbon cutting took place in mid-August, and this is a business incubator site. So this one is really one that is a unique concept, and we are excited to see how it does. So they are partnered with the Manhattan Area Technical College, and there will be this will serve as an incubation site for certain career opportunities, including childcare. So the childcare component of this is a sequence of eight, we'll call them pods, that are set up to emulate a home-based care setting so that they can mentor childcare providers seeking to start a home-based childcare business. So they basically operate for their first year in one of the pods. They receive mentoring and support, and they get their business plan going. And then the goal is that they move out into their own community-based setting, and a new provider moves into that space. So it is an ongoing incubation program to mentor more people interested in the home-based childcare setting, but teaching them the business skills necessary to be successful. All the other components are in place. This is a piece of property. The land itself was donated by Ascension Hospital, and is so they have the healthcare. There's telemedicine rooms and different features that allow for primary care services to be offered on site. So they too hit the work, education, healthcare services. They have our childcare component, and it's just really an interesting model that we are hoping is wildly successful for them. I was able to go to the first steps with Abby groundbreaking. I think at our last in-person in June, I had shared that invitation with the board. This is located adjacent to St. Benedict's Abbey on a site that was a former state juvenile correctional facility. So it was a detention center. And when the state shut those facilities down, this is one that was put up for sale. The Abbey purchased the land, and it is a little quad. It's a campus that had the dormitory buildings and central space for an outdoor I hate to call it a playground, but anyway, outdoor space. It is now housing. It too has the health care, the education, and the workforce through programs that the Abbey has set up, and they're transforming one of the dorm areas into their childcare facility. So they have a health clinic. They've got another Abbey-run piece of this facility is space for. They have dorm space for expectant women, and it's just a really, really holistic approach to caring for children and families, and helping with job training and other types of activities. It will be part of a larger campus the Abbey envisions that will have a drug treatment program. There's a YMCA that operates in the same area. It is a beautiful setting out in the Atchison area, near Benedictine College and St. Benedict's Abbey, and we're really proud to be part of this project. Clay County is building a multi-generational life center. They've had their groundbreaking just last week. I think Craig may have a little bit to say about that because he attended on our behalf. each of these projects, I think the takeaway I want you to have is that each of the 10 projects is uniquely different. It is, each and every one of them is built and tailored to the needs of a specific community and the vision that they have for what they want and need. We've got Great Bend that is targeted to open in spring. Lyon County, the Emporia area, is on track to open in 2026. Storytime Village in Sedgwick County is anchoring around a historic, a designated historic site. It's an old Victorian era home that is the corner of the property, and the development that they have underway will span each of the 2 blocks, so a 90-degree angle, if you will, built around this historic site. They were dealing with the historic preservation societies, all the process involved with renovating a historic site, and that took a little bit longer, but they achieved that milestone. All of the final approvals were conferred in early September, and with that milestone, the Historic Preservation Committee commended them for the design and the uniqueness, and so there's interest in this project as a showcase for how you interact with a historically designated site. Storytime Village offers a wonderful program in the Sedgwick County area that focuses on literacy for children and adults. So they will anchor their operation in the facility. They'll have the childcare component. They'll have a health clinic that takes some of the space being built. And they are across the street from the Wichita State campus, so they've got the right mix of programs brewing to meet all the federal criteria, and we can't wait to celebrate progress with them as well. So that is, I think, the last, if memory serves, that's the last of the slides related to CPF. Madam Chair, I will stand for questions if the board has any.
Wonderful report. Any questions or comments? Innovative, wonderful use of the funds. Thank you for creatively thinking out of the box to find a way to use it for our kids. So are we at agency updates? Let's move to that then. Do we have a list of the agencies and the folks?
There should be a slide.
Yeah. We're blessed to have a great group of members that will represent all different agencies here on the cabinet.
Lindsay, are you having Zoom difficulties? Leota, why don't you start with Craig Barnes from our cabinet to
Hi,
buy
Craig.
some time there.
Yeah, we'll start with Craig. Go.
All right.
Perfect.
Well, good morning, everybody. Thank you all. Just want to provide a few updates on behalf of the Children's Cabinet this morning. So as Melissa kind of already talked about, and so a perfect kind of segue into my first point here. Last week, I was privileged to be able to attend the Clay Center ribbon or groundbreaking. This was for their multi-generational life center. So this is a really cool concept. I won't dive into it a whole lot more than what Melissa did, but what I will say, being there in the community that day, it was really exciting to see the passion from the community as a whole. There were close to 100 people in attendance. This was an exciting public-private partnership from all parts of the community, and left that groundbreaking ceremony just really feeling really positive and reinvigorated, and excited to see how the progress for this facility continues after this groundbreaking. So that was a really exciting part to be a part of last week on Friday. Next, exciting also on the CPF front, Melissa and I will be in Humboldt next week for the ribbon cutting of the Cubs Community Care Center. So this is a facility through our CPF project that will once again be providing services from birth throughout one's life. It will have a multitude of different services, a child care facility, a primary and mental health services on site, as well as just a range of different services, a workforce resource hub that will be partnering with the community college there to provide opportunities for the entire community there in Allen County. So really excited next week to be a part of that ribbon cutting. And we'll love to be able to provide some more updates to this board on what that looks like moving forward. Next, wanted to provide a quick update as a follow-up from our last board meeting. So excited to announce that we did receive funding through our CB-CAP award to allow us to fund the full slate that the board approved at the August meeting. So with that, also excited to announce that means there's no additional action needed from the board at this time. So all award paperwork for that grant has been sent out. It's been returned and executed on our end for a very nice and seamless start to the new federal fiscal year. In a similar fashion to CB-CAP, also excited and happy to announce that the rest of the awards for our federal grant portfolios also came in as expected. And so with that, also all subrecipient notices of awards have also been sent out for all of those. And so I want to take a moment here to really give a note of appreciation to the rest of the Children's Cabinet team for all of the work that they put in the last several weeks as we got those notices, and then turned those into also our awards out to our subrecipients and the partners. I know they're really excited to get that work and continue that work into this new federal fiscal year as well. So excited. And again, a special thanks to the rest of the Children's Cabinet team for the work they put in to get that going. So with those, as you all are aware, there is a federal shutdown. So we do have this lapse in the appropriated federal funds as of October 1. So as an update to the board and to all of our partners who are listening to this live stream, we want to make sure that we state that there have been no stop work orders that we've received. We've been kind of informed to continue work as outlined within those executed grant award notices. But we want to make sure also, so we will have open lines of communication with the board as well as with all of our partners as we receive more guidance from our federal partners. But at this point in time, we have received guidance to continue work as outlined, and really excited to collaborate with all of our partners across the state. So that's all I have today.
Thanks, Craig. Any questions for Craig? Seeing none, let's move on to Amanda Peterson with the Kansas State Department of Education.
Good morning, everybody. I have a couple of things to share today. As a reminder, everybody can go to www.ksde.gov to sign up for KSDE Weekly. That is the Kansas State Department of Education's weekly newsletter, and it's a great way to stay up to date with things that we have happening in the agency. But a couple of updates to share. So last week, September 22nd, was a big day in Kansas. It's Count Day, which is the day that we use every year for determining schools' enrollment for the purposes of the school finance formula. So currently, districts are working to submit data to the Kansas State Department of Education regarding how many students were enrolled on September 22nd. That collection closes in October, and then KSDE auditors go to each district to audit that count so that we have a final enrollment count by the end of the school year. That's the same data that we use for preschool enrollment, for thinking about the number of students who we have enrolled in preschool in Kansas public schools. So we're really looking forward to getting that preliminary data so that we can see what that enrollment data looks like for the year. Last week, Monday, also marked the end of the kindergarten readiness snapshot. In Kansas, all of our accredited schools are required to partner with the families of incoming kindergarten students to complete the ages and stages questionnaires, which is a short questionnaire that allows families to share some information about their child so that the school and the family can work together to ensure that their kindergartner has a great start to the school year. That takes a lot of work, and we do appreciate that the work to help families prepare and children prepare for school begins long before kindergarten orientation. And so since 2020, KSDE has made available the statewide online platform to provide those screenings to all early childhood programs. So Part C programs, childcare providers, local health departments, other early childhood providers, so that they can be partnering with families to screen any child who is younger than the age for kindergarten entry. So this has been a very, very busy time for the ASQ. I ran the numbers this morning, and since March, Kansas schools and early childhood programs have partnered with families to complete more than 100,000 screenings using the ages and stages questionnaires. So again, a huge thanks to everybody who does that important work to be able to work together with families to check in on their child's development and determine if they might need any additional supports. Right now, it is data season, and right now the Kansas Department of Education and the Kansas Department of Health and Environment are working together to review last year's special education data. Every year, as we think about those children who transition from Part C to Part B services when they turn 3 years old to receive their special education services, we review at a child level each individual child to make sure that those children were receiving services in a timely manner. So we're in the midst of doing that for last school year right now, and our agencies also continue to work together to develop our follow-up and next steps following our federal site visit from the Office of Special Education Programs. And of course, we continue to work together to support local communities in making sure that as children transition from Part C into Part B, that is a smooth and effective process for everybody who's involved. And then others who are on might also share. It was certainly a collaborative effort, but I really want to celebrate that this week our Kansas State Home Visiting Leadership Team pulled off a really incredible job to host the Kansas Home Visiting Conference. And they did that in a hybrid format. So we had home visitors come together at regional locations in Hayes and Garden City and Topeka and Chanute and Wichita. And so all together across those 5 sites, we had more than 450 home visitors from all different home visiting models in the state. And we had a great mix. I was able to attend the Topeka location for a while. There was a great mix of virtual presentations where everybody at those 5 sites were engaged together in learning virtually, and then in-person hands-on collaboration and work together so that different home visiting programs locally could work together with the other programs in their region. So as we all get ready to bring together administration of these different programs at the state level in the Office of Early Childhood, I really just want to commend all of the hard work that went into planning and pulling off and attending that conference, because this is exactly what we need to be happening at a community and a regional level for us all to be working together as effectively as possible. We also have just a couple of upcoming professional learning pieces that I want to make sure people are aware of. First, if you're a podcast person, you can listen to the KSDE Insight podcast. It's available on wherever you might get your podcasts. But this group might especially enjoy the September episode. It focused on early literacy and all the things that families and early educators can do to help raise strong readers. So it was a really great listen, and I'd recommend it. The morning of Friday, October 24th, the State Interagency Coordinating Council is hosting a virtual event that brings together local programs and early educators and families, and it's all going to be focused on screen time and the effects of screen time on brain development, and then providing families some really helpful and hands-on things that they can be doing instead to be able to really support their children's healthy development. So registration for that is available at ksdetasn.org. It's free. It's from 8:30 to 12:30, I believe, and that will certainly be in the All In for Kansas Kids weekly newsletter, but we're really looking forward to that event. We're also getting ready for Kinders Can conferences. Those will be in December for the most part, and then in April in Southwest Kansas. But these are opportunities to bring together kindergarten and preschool and first grade teachers and other early educators for a really hands-on day of practical strategies that you can put into place in your classroom. It's a partnership between 3 of our Kansas Education Service Centers, ESDAC in Hutchinson, Greenbush in Girard and Lawrence, and Southwest Plains in Sublette. So we are very excited for that. Again, it has an early literacy focus this year. So they're really going to dive into oral language and ways to support children as they learn to speak and listen, because that's really the foundation of later literacy. And I'm really excited. They're going to have great focus on Kansas authors and thinking about creative ways to celebrate Kansas Day as well. And then finally, it's a ways off, but we're preparing for the Kansas Division for Early Childhood Conference, which is in Wichita at the end of February. This is, again, a great opportunity for special education and general education, early childhood educators, birth through age 5, who serve children birth through age 5, to come together for really great evidence-based learning. So right now there's a call for proposals out if anybody would like to present in Wichita at the end of February, but we are working to prepare for that. So I think that's all I've got, but I'm glad to answer any questions if anyone has them.
Thanks, Amanda. Any questions or comments? Packed full of info. Okay, Matthew Billinger with the Kansas Department of Corrections, Juvenile Justice Authority.
Great, thank you.
Thank you.
So I wanted to update a couple of things that I've talked about before. I think we talked about a tool for our supervision officers that are supervising young people on probation. It's called Repath. It's a phone application they can download. It's great in the sense that it keeps the kids accountable. We can kind of track where they're at, what they're doing, immediate check-ins and stuff like that, as well as giving them tools in their pockets. If they're in a stressful situation that something's not going right, there's a cognitive application to kind of work through things. And we found some pilot sites. We did a few counties in the state, and they really loved it. I mean, the feedback was just overwhelmingly positive, both from the kiddos using it as well as our staff. So the Juvenile Justice Oversight Committee approved funds through the reinvestment that we did back in 2016 for that to go statewide. So we're excited that the pilot programs worked fantastic, and we're going to expand that statewide to give some of our youth on supervision some tools to enhance their chance of success. So really excited about that. I had the chance in the past recent to go visit some of our facilities and our places where we're working with the young people. Our biggest one is the Kansas Juvenile Correctional Complex. So that's here in Topeka. That is where most, they have a serious long sentence. That's where they go and serve their time. Kind of wanted to talk about some of the great things they're doing there. Even on the adult side, Department of Corrections has always kind of had the mindset of reentry begins at day one. So as soon as we get a resident in one of our facilities, we start planning for their release. And that includes things like Social Security cards, state IDs, birth certificates. They really get that stuff going from the get-go. We have a great partnership with Department of Commerce that kind of helps us get a lot of that together. And really, I used to work with adults. I'm kind of new to the juvenile world, actually, but that was always the biggest hurdle, was getting all that documentation together. So they're doing a lot of that from day one. It can be a huge factor in their success once they go back into the community. They have some really great programs for the kiddos. They have a partnership with Washburn Tech. They have a large presence on the campus there. They do woodworking and welding. And it's not just classroom instruction either. Washburn Tech has brought in like virtual welders where they can practice those skills virtually and then eventually move into a welding shop they have within the campus. So they're getting real world certificates that they can apply when they get out and apply that to the jobs they get when they get out. They have a full wood shop that includes certification in carpentry. And all of that is on top of their partnership with Lawrence Gardner High School. So the kiddos in there that need a high school diploma still, they're going to school there. And one of the things I really love is they get out of school with a diploma from Lawrence Gardner High School. It doesn't say Juvenile Correctional Complex. It says Lawrence Gardner High School. So that kind of breaks down some of those barriers and those stigmas when they get out to kind of help them be successful, that it doesn't raise questions and red flags immediately, to help them kind of get into that workforce. They also, which I thought was really cool, they have driving simulators. So a partnership with Department of Commerce and Lawrence Gardner High School, they're working on teaching them how to drive. They're not able to get a driver's license, but they're able to get some practice in there and get some instructions. They can do the written test, but that kind of breaks down some of those barriers. So we have juvenile detention centers. So those are county run. So those are more local. We have more of those across the state. We went to Shawnee County. Those kiddos that are there are not there for a long time. So they don't have quite the robust systems, but something new this year is grants for behavioral health care. So through the Juvenile Justice Oversight Committee, and again, some of those that money we got from the reform and the evidence-based practice account, that money goes towards these juvenile detention centers. They're able to connect with mental health services while they're inside our facilities and those juvenile detention centers. And they're with those community partners already. So like Vallejo and Shawnee County will work with the kiddos inside. And then when they release, they have an appointment with that same agency when they're back into the community. So it makes for a really great transition for substance abuse as well as behavioral health care for that transition into the community. So those supports are still there. They're the same supports. It's not starting over again whenever they change that environment. So really excited about how a lot of those counties are using those funds to have in-house services, but also transitioning out as well. So that's been really fantastic there. In the past, I've talked about the Discovery Center here in Topeka. Also visits the juvenile complex for some of our kiddos that have kiddos. So some of our teenage moms and dads, they're able to still have a connection with those youth and those little ones. So they can come in, and the Discovery Center provides different activities and kind of that hardware that kids can play with on the inside that we generally don't have in our complexes. And they do that statewide even for the adults too. So some of our adult facilities are working with Discovery Center so that they can keep that bond going even while they're inside, because we find that it has a really positive effect on those young children to still have a connection with the parents and try to break that cycle of reoffending. You guys have been interested in the past. The Topeka Correctional Facility is trying to set up an environment in their correctional facility for new moms when we have residents that come in that are pregnant and deliver while they're in our custody. Still something that's ongoing. There's a lot of policies and practices we need to get figured out. So I just want to let you know that it's still ongoing, but no major updates at this time. I would be happy to take any questions. Otherwise, that's all I have for you today.
Thank you so much, Matthew. Any questions? Hearing none, we'll move on to the Kansas Department of Health and Environment with Derek Flairlage and Amy Dean Kampmeyer.
Good morning, everyone.
Hey, you go first, Amy.
Okay, thanks, Derek. Good morning, everyone. I don't have a lot to add. I do want to take a minute, though, to second Amanda's congratulations to the State Home Visiting Leadership Team, the local partners, and the supporting agencies and partners that really kicked off that home visiting conference this past week. I was unable to attend, but have received many messages of appreciation and thanks, and the efforts that were put into making this a really great conference, probably one of the best they've had in years, is one of the comments I received. So congratulations to that team, and it was a really well done, hard effort put in. Thank you, guys.
All right, there we go. There's my face. Hey, everybody. Good to, excuse me. Good to see you guys. Been a little bit of a long week, so I apologize if I look tired or the voice is a little bit lagging this morning. For those that I haven't met, I'm Derek Furlog. I am, along with Amy, one of the directors for the Bureau of Family Health here. I do also have the Bureau of Disease Control and Prevention as well at KDHE. So do some work in that space as well in public health. But I think for the purpose of today's meeting, just a couple of updates for everyone on the board. Childcare licensing, one of the programs that I'm charged with. I think that the biggest update there is really around the new licensing system. So we're still awaiting, there's a lot of state processes and approvals that we have to get for timelines on these projects. We are tentatively hoping for a February 2nd go live date on a new licensing system, which is sorely needed. Our current system, Claris, is about 20 years old, though the development of that system started in the late 90s. So you can imagine, even by the time that the system went live in the early 2000s, that was probably outdated at that time. And so we're very excited. It's one of the things ever since I started here a few years ago, we've always received pretty negative feedback on our system. So we've been very excited about getting that going. This week we actually started what's called user acceptance testing which is where for the first time our staff gets a chance to get a little bit hands-on with it, test through some of the business processes and give feedback to the vendor, to the contractor, to ensure that things are working the way that we need them to be. And so I know they had a very long week of testing. It's a lot of hard work to kind of just sit there and play with the system, but we're excited to get that going. So that's waiting in the wings a little bit. I can't think of any other big updates regarding childcare licensing. Oh, there are a few other big ones. There we go, comes to mind. So regulatory updates. I know everyone's on the edge of their seats for those. We actually have 2 packets of regulations. The first one has been with the Attorney General's office since February 14th of 2025, so since Valentine's Day, about almost 8 months now. And those were really to update our school age programs. The packet, we really refer to it as out of school time. We worked really closely with some partners across the state, Boys and Girls Clubs, YMCAs, Parks and Rec, different forms of local government that have different programs that fall under that umbrella to make some modernized regulatory changes. And it would actually make those programs eligible for child care assistance as well, which was a huge ask. A lot of those programs serve really vulnerable populations of children, and those assistance funds are sorely needed. They need access to those. So we've been excited about that. And then with House Bill 2045, the Office of Early Childhood required the agency to adopt some regulatory changes. So we have those in another packet, which is also at the Attorney General's office currently for their review. It would do the things that were outlined in the bill that needed to be updated. So if you read through the bill, it will say, that we will adopt such and such, insert language here. So those are in that packet. Of course, all of that is subject to the same requirements of public comment and public hearing, and so we'll have to do those things as well as publication in the Kansas Register. So we've got a little ways to go on those, and just awaiting next steps with the Attorney General's office in terms of feedback or potential corrections or meetings or what they might want to do to get these continuing to move forward. The other big piece for me, and then I will be done and open for questions, WIC. Our WIC program. WIC is a program I oversee with the federal shutdown. WIC has been affected, so we do operate exclusively on the federal fiscal year with WIC, and we also operate on a reimbursement basis. So we don't have funds to draw down if they are not there on October 1 of that fiscal year. So right now, you all may have seen various forms of communication come out from our agency to local agencies, to what we call clients, which are the women, infant, and children. We have about 50,000 clients that are serviced each month, about 80,000 individual unique identifiers. So that's a lot of human beings, real human beings, that have budgeted their expenses for the next month or the next month, and are suddenly, worried about not having access to those. I think the good news is we did receive some additional contingency funds from the USDA yesterday, a little bit more, over 1.1 million, and that should sustain our food funds through the month of October. And we will be hopeful that the federal government either finds a temporary or a permanent solution in that time frame. Otherwise, we're continuing to monitor our funds. We're working really closely with the USDA's regional and national office, with the contacts that are still there, still working, and so we're just hopeful that an agreement will happen in that time frame. But if anything changes, we're going to communicate out broadly to the public. We're of course going to communicate to our WIC clients and our vendors. There's an economic component to this too, where grocery stores, our retailers rely on these clients to from the economic perspective as well. So we're just monitoring that situation very closely, and should anything change. But I want to reiterate, WIC clients should continue shopping as they normally would. We're not concerned there. We do have enough food funds to get us through at least the calendar month of October. So we'll continue monitoring closely. With that, I will take any questions.
Thank you, Derek and Amy. And Derek, sorry I botched your last name. I will not do that again. With a name like Lietta, I'm sensitive to making sure everything's
No
pronounced
problem. I am used to it as the app.
well. I'm sure you are. Any questions or comments? If not, seeing none, let's move on to the Kansas Board of Regents and Brandy Wells.
Hello. So I am representing the Kansas Board of Regents, but I work under the Workforce Development Team. And earlier this week, we helped co-host the Workforce Innovation Center Conference with Kansas Works, and it was an awesome opportunity to hear from wonderful speakers. Some of them were the KCCTO. They shared an update on childhood pathways. Ted Abernathy presented on Kansas economic data and strategies for helping businesses grow. But one theme that really stood out to me and has already been addressed during this meeting is people talking about the way business and industry since I've started has talked about wanting to see more of those soft skills. And at this conference, they really talked about how those soft skills are formed in early childhood and the very beginning of life. So it was really cool to hear that kind of stuff. Another thing that was really cool to hear and learn about was K-State just released this platform and it's called All Things Kansas, and it puts a lot of data all into one spot where you can compare things. When they were presenting it, they used childhood data as their example. So they were comparing things like the cost of childhood in a certain area versus the lack or the need for childcare. So it was really cool. And I can put the link for that in the chat, but that was a really cool resource that's now become available. And other than that, we're trucking along with data.
That sounds amazing. Thank you for sharing it. Yeah, if you want to put the link in the chat, that would be great, Brandy. Any questions for Brandy or comments? Thank you. Seeing none, I'll move on to the Kansas Supreme Court and Office of Judicial Administration and Justice Standridge.
Hi, thank you. I'm, going to follow up a little bit about our Child Welfare Summit, which we're coming up in a couple weeks on it's been 18 months. So the 31 judicial districts each had a team that we put together of child welfare partners, and we meet every 6 months. The next one is October 10th. They last anywhere from an hour and a half to 2 hours on Zoom. This time we're doing some breakout sessions, and they've been really great as a way to collaborate and share what's working in some districts, what's not working in some districts, and being able to collaborate about that. What I'm really excited about is a new Child Welfare Summit webinar series that kind of came out of the summit. And it's an 8-part series, and it's called How to Work with the Courts. And it's designed really to continue the work of looking at how courts and child welfare providers, again, can collaborate, for the benefit of children and families. You'll remember that we had over 750 people attend the summit, Child Welfare Partners. 300 of them have already signed up for the webinar. The first one, they're monthly, so the first one is next week, and our license allows us 1,000. So if anybody is interested, you can, just go to our website and look at, how to work with the courts webinar series. Just search that, and it should come up. Another thing we're doing to keep the momentum alive is a parent-partner program pilot in Douglas County. Maybe you'll remember that we did get a $750,000 grant for this program in December. That was for 5 years, and then the government pulled it back in March. The Casey Foundation has graciously given us some money to at least pilot the program to the extent that we can. So what's interesting here is that this whole thing kind of came out through, I didn't know what a family resource center was when I first joined this cabinet as an ex officio member. I don't remember, Melissa, maybe it was a year and a half ago. Yep. And once I found out what they are, there is one in Lawrence, and it's called the Community Children's Center. And this cabinet funds it's a family resource center, funds this FRC as part of the CCC, it's a Community Children's Center, broader Early Childhood Community Center project. And so the grant money from Casey is going to them, and they are hiring a parent partner. And this parent is somebody who's had their child or children removed and then also had their children reunified. And that person it's a full-time job with benefits. They will partner with a new parent coming in, and from the very first hearing, it's somebody that's not affiliated with, the state or the court or or the case manager. It's just through the Family Resource Center, and will not only walk them through, this is what the court process is like, this is what you need to focus on, this is what you need to ask your attorney about, this is what you need to talk to your case manager about. But they'll also use the Family Resource Center as a way to help them with, if they need housing or transportation or need job training, vocational training, or they need help with food or, whatever it is. So we're really, really excited about that. We've posted the job, and we're having a little bit of trouble finding somebody. So if you know of anybody, please feel to reach out. The pay is about $36,000 or $37,000 a year with benefits. We also, out of the summit, came this Family Ad Astra committee. I don't think I've ever told you about this committee, but it was kind of created. I had a committee that helped me plan the summit, and there were 22 people on that committee. So with that committee gone now, because the summit's over, we pulled some people, and we have this Families Ad Astra committee, and it was created to basically just continue brainstorming for new ideas after the summit. One of the things we're exploring right now, but we don't have the money for, is a phone app to facilitate and basically document communications between parents and caseworkers. It's kind of like your MyChart, or, I don't know what you guys have, but like a portal through a doctor or hospital. You can ask questions, provide updates, upload documents, and it's all there. And so we do, have, it's the same positions that are turning over, but we do have a lot of turnover with caseworkers, with our, what do we call them? Like the contractors. And so this way, everything would be in one place. It wouldn't just be in the caseworker's head. There is a company that launched an app, and forgot somewhere in the South, they're using it. It's been really successful. And so we're exploring ideas on how to maybe find some kind of grant, so that we can pilot that project too. Finally, this is, we just passed September, which was our 1-year anniversary for family treatment courts. As a reminder, our family treatment courts, which also came out of the summit, are like drug courts where you have parents with substance use disorder whose kids have been taken for that reason. And instead of having an adversarial, sync case, the sync case goes into this family treatment court. The judge doesn't wear a robe. They're seen every 2 weeks. They have wraparound services. And we are going to have our first graduation next month. So I think that wraps it up. If anybody has any questions or wants any further information, please let me know.
Thank you, Justice Standridge. Wonderful work going on. Any questions or comments? Seeing none, we will move on to the director's update, including PDG. Let's hear about it, Melissa.
Thank you, Leetta. I am pleased to announce that, and Craig alluded to it, the Preschool Development Grant Year 2 grant award was received. So we are full speed ahead with that work, which is a really important component of the work going on to move Kansas from the current system to the collaborative, coordinated, moving the coordinated model into the consolidated model and opening the Office of Early Childhood. So it's the work involved with preschool development grant is also supporting the ongoing development of the professional workforce registry for childcare providers and some other really important projects with partners around the state. So we are pleased to have that opportunity to serve as the project lead of a team that involves our 3 partner agencies. Office of Early Childhood planning is in full gear. It's being led by the governor's office and the transition director, Zach Vincent, from her team. We at our June meeting had a motion that approved us to provide $150,000 of our CIF infrastructure line item to support the transition planning efforts. That agreement has been completed and is in place. The work that in this first quarter, as you can imagine, it's the groundwork for the logistics of moving funding streams. In, structurally, it involves a whole host of sources, and so there's got to be a landscape analysis and the prioritization of the steps involved with making sure that happens seamlessly, because the overarching goal is to make sure the provision of services across the portfolio is seamless as we make this transition next summer. Each of the agencies that has programs that are involved in the move, what has been asked and we've all provided details about staffing and the grants and awards and agreements and all of those things that has been conveyed so that it can be factored in. I think the work is really focused right now working with the 2 key agencies that have a much more complicated role in this. The cabinet moving in its entirety makes it a very simple, clean assignment to say, here is our staff list, here is what we are all assigned to do, here are the list of all of our grants and awards and contracts and agreements and all of that. Here you go. There's no question about which of those things is moving and how much of a particular position is supported by this fund or that fund. We are being picked up and moved in our entirety. So I haven't had a ton of involvement other than addressing the requests as they've come in. There is more intensive work with KDHE, DCF, and to some extent KSDE, although Parents as Teachers is the one program and there is one FTE and it is actually one person, and we have resolved all of the questions about that one. But where you have larger agencies and funds that are moving out of different divisions that are helping contribute a % of funding for certain things in agency administration and staffing, that's where the focus is. So I think things are moving smoothly, and I don't have any additional information beyond that to share. I'm comfortable with where things are. There is an open application for the position of the director of the office. The timeline involves governor appointing by January and Senate going through a confirmation process in order to seat that person by July 1 of next year would be the goal. I do want to note that the Children's Cabinet submitted a letter of interest for a grant opportunity. It is small in the grand scheme of things. It would be funding for us to help support some of the work that is involved with thinking about how evaluation and reporting is designed for the new office. We have, as we have emphasized in this meeting, our approach to that is robust. It is cabinet specific. So it's a grant from the Early Childhood Funders Collaborative, which is this particular grant opportunity is a partnership between the W.K. Kellogg Foundation and the Heising Simons Foundation to provide the funding. We're talking, no more. I believe the ceiling is $250,000. It would just help support the analysis needed to see how much of our approach can be adopted for the office, so that we are well positioned in the Office of Early Childhood to answer to all of the reporting requirements outlined in state statute, continue to meet federal guidelines for reporting, our cabinet approach, trying to make sure that we adopt a cohesive approach to that keeps things as streamlined and as minimal a burden on those involved with doing the reporting as possible. We want to be efficient but effective. So don't know if we'll get it, but it was an interesting opportunity I learned about at a summer convening of the Education Commission of the states. There was a wonderful breakout panel with it was on this topic. It was several states that had received this grant last year. So we're hopeful. Kansas was the only state in the country to pass legislation in this immediate past legislative cycle to do this consolidation. We have many states ahead of us in the process that are serving as mentor states, and are, certain offices are opening this year because they had started a year or two ago. But anyway, so we feel hopeful that that grant might help support some of those activities, work with the KU team and the Wichita State team and others to help think about our approach to data and evaluation. So that I will keep it short and sweet. You've heard plenty about everything else related to cabinet business today. Madam Chair, if there are any final questions from the board, I would be happy to entertain them now.
Thank you. Any questions or comments from the board? It's been a great meeting filled with lots of information. Our next meeting is scheduled Friday, December 5th. It will be held virtually. And then you can see the proposed 2026 scheduled meetings. April seems to be in play. Is that right?
Yeah, I guess, Madam Chair, what I would want the board members present to know is that the April 3rd date is the first Friday of April. So in keeping with cabinet protocol, the first Friday of alternate months, beginning with February and ending with December, as you can see on screen, is the date that we plan our meetings. We try and give board members certainty about when to book time on their calendars for this particular obligation that comes with board service. We always start our meetings at 9, as you know. The variable here is April 3rd is Good Friday, and we do have a quorum. We could take a vote. We normally adopt the calendar for the following year at the October meeting. I would defer to the wishes of the board. The decision point is whether this board would like to adopt a schedule that defers the April meeting to April 10th instead. We can hold for discussion at the December meeting when hopefully we have more than just the bare minimum quorum present, or we could go ahead and adopt, and we can always change if it is the desire of the board. We will, I guess what I want to communicate is we will address this in December for sure. Up to you how we deal with it in the moment today.
Do we have any discussion or a motion about the proposed meeting schedule? April 10th also happens to be Senator Sykes' birthday.
I just want to add, it is my birthday and I'm happy to, but veto session for the legislature is supposed to start on April 9th, and then we're supposed to end our session on the 11th. So that would be maybe my concern for the legislators, that we could be in veto session.
I think we should assume that that is a very bad idea to schedule April 10th as the meeting date. Why don't we hold, and in December we can have a discussion about the April 3rd date, and we can address it then. But this is the picture that you all should take away, that this is the 2026 timeline for meetings generally. So think about, I'm sensitive to the fact that families may travel for, to get elsewhere for Easter. I know April 3rd might not be the best choice, but we've done it. The morning of that Friday, sometimes the makeup of the board is people willing to take the time to meet. I don't want to speak for the board. We'll come back in December with time carved out to discuss the meeting schedule together.
I think that sounds like a great idea. That sounds great. Any other comments or questions before we head out? Thank you to all cabinet members and our amazing staff, our team, for all the work you do on behalf of Kansas kids and families. If there's no further business to address, I will entertain a motion to adjourn.
Representative Williams, I move we adjourn.
Okay, second, anybody?
Second.
Okay, so Representative Williams made the motion, seconded by Senator Sykes. Let's do a voice vote. All in favor, say aye.
Aye.
Any opposed? Okay, we are adjourned. Have a great weekend, everybody. Thank you.
Bye. Thank you.
Bye.